Welcome to the Explainer. We're about to dive into a masterpiece of biological engineering, something you use every single day, whether you're a world-class athlete or, just walking to the kitchen. We are talking about your knees. That's right. Your knee isn't just some simple hinge. It is by far the largest and most complex joint in your entire body. It's this incredible intersection that has to handle unbelievable amounts of force.
Just think about it for a second. Walking, running, jumping, even just sitting down and standing back up. Every single one of those moves relies on the smooth, powerful function of your knees. They are absolutely fundamental to how we move through the world.
So, to really get how to protect our knees, we first have to understand what's actually going on in there. So let's pull back the curtain and take a little tour.
Okay, everything starts with the frame, right? You've got 4 key bones meeting up here. You have the massive femur, that's your thigh bone, coming from above. Then there's the tibia, your main shin bone, taking all the weight from below. The fibula runs alongside it. And then, sitting right out front like a little shield, is the patella, what we all know as the kneecap.
Now, how do you keep these huge bones from just grinding each other to dust? Well, the body has this brilliant solution. 2 kinds of cartilage. First, the ends of the bones are coated in this incredibly smooth, almost frictionless layer called articular cartilage. It lets them just glide over each other. Then, wedged in between, you've got the menisci, these 2 C-shaped pads that are just perfect shock absorbers. They spread our weight out nice and even.
But with all that smooth gliding, what stops the whole thing from wobbling apart? That's where ligaments come in. Think of them like these super strong, fibrous ropes that lash the bones together. The big 4, the ACL is the famous one, they provide all the stability, stopping your knee from sliding too far forward, backward, or side to side.
Okay, so ligaments give you stability, but tendons? Tendons are what give you movement. They're the tough cords that connect your muscles to your bones. So when you decide to straighten your leg, your huge quad muscle contracts, pulling on the quadriceps tendon. That pulls on your kneecap, which then pulls on the patella tendon, and voila, your leg straightens. It's this amazing chain reaction.
Now, this whole structure is, it's a marvel of engineering. But because it's so complex, it's also pretty vulnerable. So let's look at what happens when some of these parts get damaged, which leads to some really common knee problems.
Arthritis is probably the first thing people think of with knee pain. But it's really important to know there are different types. Osteoarthritis is what most people call wear and tear. That's when that smooth cartilage literally wears down over time. But rheumatoid arthritis, that's a whole different ballgame. It's an autoimmune disease, which means your own body's immune system gets confused and starts attacking the lining of the joint.
We hear about it all the time in sports, right? Some superstar athlete goes down with a torn ACL. It's this devastating injury. But what is actually happening inside the knee when that goes down?
So an ACL tear happens when that crucial stabilizing ligament, that rope we talked about, gets stretched way too far and it just rips. This usually happens from a sudden stop or a really sharp change in direction. And since the ACL's main job is to stop your shin bone from sliding too far forward, when it tears, the whole knee just feels incredibly unstable, like it could just give out from under you at any second. And while the ACL gets all the headlines, it's definitely not the only thing that can go wrong. A really forceful twist can tear one of those meniscus shock absorbers. Too much repetitive jumping can inflame your tendons, giving you what they call jumper's knee. Even the little fluid-filled sacs that provide extra cushioning can swell up in a condition called bursitis. It's a complex joint, and pain can come from a lot of different places. So, with all these potential pitfalls, the big question is, what can we actually do about it? Knowing the risks is one thing, but being proactive is what really counts. So let's open up the user manual for protecting this powerhouse joint. It really does boil down to these 4 main pillars, and they're pretty simple ideas, but they are so powerful when you actually do them. It's all about managing your weight, building up the right muscles, making sure you're moving with good form, and of course, fueling your body with the right stuff. Okay, let's start with weight, because the physics here are absolutely staggering. For every single extra pound of weight on your body, your knees have to deal with 4 extra pounds of force. Every time you take a step. That's a 1-to-4 ratio. So think about it. If you're just 10 pounds overweight, that's 40 extra pounds of pressure hammering on your knees with every single step. It adds up so fast. Now, exercise is key, but it has to be the right kind of exercise. Low-impact stuff like swimming, cycling, or even just walking is fantastic because you're building muscle without all that pounding on the joints. You really want to focus on strengthening your quadriceps on the front of your thigh and your hamstrings on the back. They act like your knee's own personal support system. And please, don't forget to stretch. Being flexible is one of your best defenses against injury.
And you can help from the inside too with what you eat. For the bones themselves, the frame of the joint, you need calcium and vitamin D. Think dairy and leafy greens. And to fight off inflammation, which is really at the root of so many knee problems, you want to look for things like omega-3s, which you find in fish and walnuts, and even spices like turmeric and ginger.
Now, of course, all of this is to help you understand your body better, but it is absolutely not a substitute for real medical advice. This is so important. If you have pain that won't go away, or swelling, or that feeling of instability, you have to go see a doctor. Get a proper diagnosis and figure out a treatment plan. So, as we wrap this up, I'll just leave you with this one thought. These incredible, complex joints literally carry you through your entire life. So now that you know a little more about what's going on in there and how to take care of them, the real question is, are you giving them the support they deserve? Thanks for joining us on The Explainer.